I had and still have imposter syndrome.
From time to time, I feel like an imposter.
I've experienced imposter syndrome.
I have imposter syndrome.
I have had and sometimes still do have imposter syndrome.
Imposter syndrome is when you have a kind of feeling of self-doubt or inadequacy, when really actually it's at odds with your experience or your prior positive outcomes previously.
To me, it's those sort of anxious voices in the back of my head that are saying, you don't know what you're doing, someone's going to know, are you sure that's what you want to do? And it can be about any decision, big or small, and I think it can be in all areas of your life. I had the feeling of imposter syndrome even coming here today.
In any sort of situation where we're unfamiliar with it, one might feel like an imposter. And it's very clear that in any kind of training, and medicine's a training thing where you go from one level to the next level to the next level, etc., you're going through a series of transitions. And at each transition, you're going to do something that beforehand you weren't able to do. So that's feeling an imposter. That's quite normal. And we'll see that throughout medical training and probably many other trainings as well. But imposter syndrome is when it goes beyond that and you become unfunctional in that situation.
What are your thoughts about imposter syndrome?
Well, imposter syndrome is super prevalent. So many people have issues with feeling like an imposter, and for some it becomes really debilitating.
You've mentioned the word debilitating. Do you think it's a bad thing to have imposter syndrome?
Well, I think we've got to make a distinction between feeling like an imposter and imposter syndrome, where it becomes much more of a pervasive problem and actually really gets in the way of your function as a doctor, but also your well-being as a person. But the imposter bit is what I think everyone will experience.
Why do you think medics are more at risk of imposter syndrome?
Well, I'm not sure whether we're more at risk than perhaps another profession, but if you think about what we do as we go through our training and our career, we are asking ourselves to progressively do more and more complicated things. And when you start off in medicine, you look up and you think, crikey, that SHOs can do all sorts of things. And then when you're an SHO, you think the same with the registrar and the registrar of the consultant. So there's a progressive change as you go through. And for each level, you imagine the next one up is an almost unattainable position to be in. However, a few years later, that's exactly where you are. So you're not only thinking, well, gosh, how do I actually do this? Because you've never been in that situation before, but you've already put into your own head a psychological barrier to being there before. So it's quite normal, I think, to feel like an imposter, particularly at those transition points.
I think probably the situations change, don't they? So in your everyday work, I can't think of the last time I felt imposter syndrome, but then you put yourself in a new situation, and a situation where you might feel slightly out your depth, even though reality is you've got the skills, the knowledge, experience, or if you're unfamiliar with those around you. Whereas if you work in a department, you know people. And
I think that at whatever point you take on a new role, it starts again. Because we have such high expectations for ourselves when we work in this setting.
Overcoming that thought of imposter syndrome can be really difficult. Sometimes I don't manage it at all, actually. But often I just think, if I were to talk to someone else who came to me with these problems, what would I say to them? And sometimes it's just remembering to talk kindly to yourself.
When I was a fairly new consultant, I think it was probably my first patient on paediatric intensive care that died with me. And you think, crikey, this child's ill, what do I do now? And you assess them and you think, well, I've gone through everything. Am I really going to have to stand with the family in this sort of situation? You're doing everything you can. And in the end, actually, I phoned up my colleague, who was much more experienced than me, really just for the additional reassurance that there was nothing else that I could have done. And that's actually, she was delighted to help me in that situation. And that's actually a totally legit thing to do. Our trainees do this by phoning up their consultant or talking amongst themselves sometimes. But consultants also do this, phoning up other consultants saying, have I missed anything? It's absolutely fine to do that. You build teams where that's a totally appropriate thing to do.
I would recognise that actually it's a very common phenomenon. Whether should we use the word syndrome or actually make it more normal? It's something that everyone experiences at some stage. And to probably also to encourage and validate those around you, because if you're doing that and creating that positive kind of culture, then actually that's a really empowering and hopefully reduce that sense of imposter syndrome amongst trainees.
My advice would be that imposter syndrome is completely normal. It's something you kind of need to embrace. It's part of being a new, whatever role you're going to be. There are always people to ask. And almost the moment that you think that you're very comfortable with something is the moment that you probably should challenge yourself more.
So I suppose as the LSP, how can we support our trainees or anyone that is feeling that they have imposter syndrome?
Well, probably the first thing to do is to note that really everyone should feel like an imposter from time to time, but that shouldn't be stopping you doing your job. It shouldn't be getting in the way of your well-being, and it shouldn't be preventing you in your training. But you should feel those feelings, gosh, am I really the right person to do that? So once you've kind of normalised it in that way, you have to take a step back and think, well, maybe I am the best person. I think the first thing is to try and normalise it. I think that's probably the most important thing, and know that everyone has that from time to time. I think the second thing we do is to actually specifically look at transitions in training, where actually you move from doing one thing to another. Maybe that's from a first tier to the registrar tier or the middle tier, or then as a consultant, and actually specifically help our trainees go through those and explain to them what's important in the next at the next level, and what you have to do and how to be prepared for it. And that would be really helpful, I think, for them to see that actually they are well trained, they are properly prepared for these things. So although they might be feeling like an imposter in that, actually that's a feeling that's going to pass, because actually they've got the skills in order to survive and thrive in that new level.